Good afternoon. This is Media Center Ukraine Odessa, and we continue with the briefing dedicated to psychological support for military personnel. Our speakers are Oleksiy Kruglyachenko, psychiatrist, clinical psychologist, Olena Brener, psychologist, military officer, and Oksana Aleksandriyska, Ukrainian Medical Center for Rehabilitation of Mother and Child. Good afternoon, everyone. Of course, today's topic is very important, and first I would like to give floor to Ms. Olena Brener. What are the mental support programs in Ukraine? Could you please sit closer to the mic? When it comes to rehabilitation, it is not well covered because not many soldiers can be demobilized and be involved in rehabilitation. So we could talk here about those veterans that have left the armed forces of Ukraine, and that's why I believe that we should discuss how to prevent PTSD, what we can do as the society to minimize the risks of rising of PTSD. And this is the attitude of the society to the military. And we are all citizens of the one state, and our military is also the part of our society. These are the same people as we. And the situation in the society is when there is an attitude to a veteran as to an alien. And this is also the issue of awareness about importance of mental health. This is the question of psychoeducation. This is the fact that our children, our youth should know more about mental health, PTSD, what to do with this, how to discuss this topic with others, how to talk with a person with PTSD or with the family members of a person with PTSD. PTSD is a problem, has been demonized as if every soldier was a killer, some insane person that we should be afraid of. But this is not the truth. And PTSD does not happen that often with the military. And I've worked with a lot of soldiers after combat, and I can see that people are not that much injured by the hostilities than by the childhood. And this is the general problem for the whole society, because people are very vulnerable to the stresses that they got during their childhood. There is a huge amount of issues that we should solve before discussing rehabilitation of people with PTSD. And the war just deteriorates the situation with the stress. Yes. And this is the possibility to respond to challenges. This is the issue of resilience of each of us. And this is the ability to be united, to support each other. A person should feel that if they do something for the military, they do this for themselves. Otherwise, they will not be able to survive. I have a question to Oleksiy. At what stage military personnel should start getting mental support, mental help. First, I would like to ask the question that you referred to Ms. Brener. Before rehabilitation, we need to treat person with the PTSD because this is a disorder of their psychic and behavior, and here should be involved psychologists and even more psychotherapists, social workers, etc. But this is a disorder that should be treated with the help of medicine, like antidepressants, neuroleptics. So some pills should be taken. And this means that a person should refer for aid to a psychiatrist. And we know the general attitude to psychiatrists in our society. People believe that only crazy people refer to psychiatrists. So they believe that it means that people would be sent to mental hospitals, they will be treated there accordingly and will become kind of vegetables. And PTSD, I could not agree here with my colleague because I believe that PTSD is under-evaluated. Yes, there is kind of demonizing in the sense that a person with PTSD can take a grenade and kill someone. But this is not that often. As for under-evaluation, a person with PTSD with time can lose its capacities when it comes to being part of a society, their family, and when it comes to work. And now, answering to your question, at what stage should military personnel be treated? I don't like this differentiation between the military and civilians, because actually PTSD could be in different people as a result of mental trauma, which is difficult to cope with. So first we have an acute reaction to stress, some disorders with adaptation, and there are some categories and classifications that say that in half a year, in 6 months, we can see PTSD in half of those people who have faced some trauma, and half of these people will recover by themselves, but in another half, this PTSD can be preserved for many years. And we need to provide aid to people at any stage, because even at the stage of acute response to stress, this person can be dangerous for themselves or not. Because when we speak about acute response to stress, sometimes this immobilizes people. They just can stand and do nothing at the front line, which is dangerous. And the same is for civilians. Instead of hiding during an air raid, people just don't hide because they just stand there looking around and don't do anything. And this is dangerous for their health and life. So, at what stage should we provide aid? When people work with the military and see that someone has changes in their behavior, they become distant, they have disorders in their sleep, when there is something untypical in their behavior, because PTSD is not the only problem. PTSD is just one of a range of issues. Should these people be taken out of the combat zone, or could mental aid be provided at the spot in the field? It is not only about psychological support. Sometimes a pill is enough to calm down a person. Olena can share her experience, how the aid is rendered there at the front line, because I'm not aware of the situation. I work here with the people who are just left for 2 weeks or have been demobilized. And sometimes people think that psychological support, oh, it's fine. Your comrade has been just killed, but you'll be fine. But it is not that efficient. I do have information about supplies to medical units of separate brigades. And sometimes in their supplies they have medicines that are not efficient because there are no proof of their efficiency, and I don't know why they provide such medicine. There are some other medicines that can make it even worse for people who are keen to suicide. Maybe there is some general plot, I don't know. But coming back to your question, what psychological support should be rendered, we need to have a complex, comprehensive assessment of the state. We should identify who should be responsible for such assessment and who will do this. I cannot give you an advice that people with disorders in their sleep should be taken from the front line. I can add that now in the armed forces of Ukraine, they try to implement the new tool. These are instructions for the first mental aid. These are not professionals in mental health, but these are people who receive experience and who undergo special training to get ready to support the military at the front line. It is very important because PTSD and the risk of its development depends a great deal on the quickness of the support that can be rendered to such persons, to normalize this person, to stabilize this person in their contact with other people. And as for demonizing, I'd like to explain myself. We are not talking about demonizing PTSD. It's just that they use this diagnosis for trying to apply to all people. And all people who return from the front line are approached as if they have become crazy. But according to the statistics, our military is not the most vulnerable part of the society when it comes to PTSD. And it is very important that we are here on our land. And this provides senses to people in their activities. And it diminishes the risks of PTSD development. For example, when it comes to American soldiers in Vietnam, the statistics was different. And when we will have statistics in our country, they will be really different from what they have in the United States. There is a question. And I'm interested in what you've just mentioned. Usually, the American experience in Vietnam and Afghanistan is made during different trainings because this is overseas experience for these soldiers. Do you have information about surveys, research to assess our military, for example, in Yugoslavia, in Israel? So the soldiers that were in the same situation that our soldiers. I'm not aware of that. A lot of research, and I have studied this issue when I was overseas. And I can fully agree with Olena here, because when a person defends their own land, they are more motivated, and the probability of PTSD development is less comparing to soldiers that serve in other countries, not in their homelands, like in Vietnam and Korea. And when a person is unaware of what is going on, the situation is different. And in our conflict, if we will assess the real situation, the the level of PTSD among soldiers will be higher than will be less in our soldiers will be less compared to those of among Russians. Like 15-20% of those who have faced the issue, and after brainwashing, a person believes that they defend someone for some reason, there will be no PTSD because you need brain for PTSD, and if your brain is washed, there are no problems. But when it comes to the Russian Federation, and if the person was mobilized and sent to Ukraine, and the person doesn't want to do anything, but they have no choice, then we should expect the development of PTSD in such person. There is a lot of research, but the idea of PTSD, the concept just emerged in the mid of 2000s. Before that, it was not well described. There was no such PTSD after Vietnam. That was Vietnam syndrome. There was shell shock, Afghan syndrome, etc. As for Afghanistan, we have no research and studies of the situation. I tried to do that in 2016, but and I need some statistics from our Ministry of Defense. And the situation is as following. Back then, the contradiction was not that big. There was the anti-terrorist operation. But if the person is mobilized and then it has some diagnosis, at least PTSD, there should be some reimbursement. There should be compensation for a person to be properly diagnosed. But back then, it was not a mainstream for such diagnosis because of the need of further compensation. That's why when we applied to the ministry to get information, I received information that in 2016 we had only 14 persons with PTSD diagnosis. So it's just what uses you read and how to diagnose PTSD. That's why I don't trust either Russian studies or Ukrainian studies. And the question about a soldier with PTSD, others people dangerous. What would you like me to compare the level of danger with? It actually is not the problem of being dangerous. There are some other cases more dangerous when person takes something like amphetamine or just alcohol. Such person will be much more dangerous compared to PTSD, because when it comes to PTSD, there are flashbacks. Such people are distanced or detached from others. There could be a hyper reaction because to some simple irritants, some triggers. When it comes to such response at the front line, then it can save people's life. When it comes to like peaceful life, there is some explosion because of a balloon. A person just rushes, takes knives, and injures someone. Then the situation is different. But such responses can save life at the front line. And usually we can see the worsening of the state when a person is taken from that area. And I mean that when it comes to a severe psychological condition, soldiers cannot perform their tasks. Yes, they can be potentially killed or wounded. If a person is under stress, instead of hiding or they just start running, they will be noticed, and unfortunately they could be killed. And this is my question, that they are dangerous to their comrades. It's just the acute stress response. This is not a PTSD itself. It's that a person can do something when performing their tasks. But we should be careful about the terms PTSD. It's post-traumatic stress disorder. This is delayed in time. And we should define a specific period, specific term when we see that a person cannot recover after the stress. So it's from 1 month to 6 months. So this is the difference between a chronic PTSD and PTSD that occurs after a trauma. But the acute stress response is really a problem. And the person is dangerous, and I can agree to Oleksiy. The person is dangerous not to other people, but to themselves. So this person can open the position, and it can perform properly their duties. That is my question. And they cannot support other people. And there is a different issue. A lot of people with different mental disorders were mobilized. I have a lot of patients with bipolar disorder, people with schizophrenia, with the personality disorders. So we have a huge bunch of different disorders that prevent you from being mobilized. You cannot be with such disorders at the front line, but actually it's happening. And here we should remember this medical examination commission. Yes, this is the problem with them. I think that we should now give floor to Oksana. As far as I understand, that rehabilitation is needed not only for the military, but also for their families, because quite often it is very difficult for families to find that key to the person returning from the front line. I would like to provide information about our center. I am representing the Medical Center for Rehabilitation of Families. Since the first days of the full-scale invasion, we have opened our doors for all people affected by hostilities, and we are located near the railway station, and we saw the evacuation trains, and volunteers referred to us people suffering from the military activity, from the hostilities. And we have representatives of all over Ukraine, Kharkiv, Zaporizhzhia, Mykolaiv, Kherson regions, and people just fled. And actually, we had such a case that a woman got driving license just on the eve of that day and left Donetsk Oblast with her children. And she was able to cover that distance, long distance from Toretsk to Odessa, having not that big experience in driving. But she just wanted to save her children. So our priority is rehabilitation of the families, soldiers, of the families of fallen heroes. And those people who have been internally displaced, and those who have been affected by hostilities. And we've provided services to more than 1,000 of persons in need of rehabilitation. More than 700 of them are children. And children even referred to us by themselves. They referred first to volunteers, and volunteers brought them to our center. We had a boy from Mykolaiv who was just 15 years old, and he just asked volunteers to get him out of the Mykolaiv region. At the moment, in our center, we have around 8-9 persons. And we prepare individual rehabilitation program for each patient, each person that envisages examination. And they work with neurologists, psychiatrists, psychologists, psychotherapists, physical therapists, cardiologists. And under the umbrella of this rehabilitation program, people can receive consultations from the experts they need. We have the department of physical therapy, and also my department, the psychological department. Department for Behavioral Correction, and also some renewal procedures, recovery procedures as massages and physical training. And I would like to note that over the last 2 months, the management of our center has established multidisciplinary mobile teams, so the teams of mental health. These teams comprise of experts that are needed in a specific community, and those teams get to the field to work with the local population. So mainly these are the families. Our beneficiaries are families of soldiers, families of the fallen heroes, large families, and families affected by the war. For example, now we have a family from Kherson, and their house was completely destroyed during shelling. That was at night when the mother was asleep, and the missile hit the house. The house was on fire, and mother lost her consciousness. But her 2 daughters, they managed to get her out of that burning house with multiple traumas. And this family has nothing left with, and so they are now staying in our center. We also cooperate with the care service of the separate brigade of territorial defense 126, and they brought to us the family of a fallen hero. And I would like to speak separately about this case. This is not PTSD. This is the state of acute grief because he was killed on the 4th of September, and the situation is very difficult with that family. And actually, a father was a star in this family, and it is very difficult for children to cope with the situation. We have wives of soldiers as well. And a woman faces the situation of additional burden when her husband is in the army. Women, they should take care about children and about their household activities. And for example, we have a woman who says that she cannot do nothing without having a message from her husband saying that he is safe and sound. This is everything, the only thing she can think about. They cannot sleep and they cannot do like simple things. And the rehabilitation course takes 21 days. This is free of charge. And we should just give the documents needed. And everyone who requires rehabilitation can get services from us. Do you have cases when people return to you after rehabilitation? Such cases are there. And sometimes rehabilitation is enough for half a year, or they just can address us in 6 months or in 3 months for additional support, because they feel that they have some symptoms and they're afraid of having again panic attacks and the impossibility to live normally. And do you have the situations when you need support a person throughout their lives with the repeated courses of rehabilitation? I do not have such statistics. Can people be fully cured? Yes, of course. PTSD is not a sentence to a person. In some cases, there can be more severe cases, but in other cases, people could fully return to their previous, like, normal state. Do we have such problems when the military addresses to a psychologist or a psychiatrist, and they just only make it worse for the military? It's really there. The problem of the PTSD is the following, is that we will discuss this topic, but then we'll leave these premises. There could be some other discussions, or there could be a conference, or it could be a grant. And this could be some other conferences, round tables. So they just discuss the topic. But who will work? The thing is that those ex-specialists that were properly trained, they were not trained how to deal with PTSD, because this is like a new concept when it comes to diagnosis. So they don't have their skills and knowledge. As for the young, experts who undergo training now, I have a question here. Who can train them? Who can teach them? They're poorly trained. They don't have the knowledge, the skills they need. Because in most cases at the university, they want just to earn money, and graduates, they cannot do anything because they do not receive the skills and knowledge they need. There are American materials, American approaches. They are there. I've seen them. And for the United States, this is quite okay for a person to refer to a counselor, psychologist, psychiatrist. It is okay for people to take antidepressants. This is not a big problem. And in our case, in our country, this is a problem. This is a problem for a person that should refer to psychiatrists that are demonized, and sometimes they are poor experts, and the person cannot get the support needed because they will prescribe with some inefficient medicine. And a person could think that no one could cure this person. Then such people can refer to Insta coaches, Insta psychologists who sell their brainstorms, training, some intensive sessions, but they don't have enough knowledge and they cannot provide this because PTSD is a psychological disorder, and have the law on psychological disorders saying that only experts can treat people in this case. And once such people try to treat something, there is no good result. PTSD is a great topic for PR. You can earn money here, and you can discuss it in social media. You can just have round tables, discussions, but the question is still there. Who will work there? Like Olena, like Oksana, who have their centers, but they cannot cover the whole population. And so then some people working for the states who earn 3, 5, 7, 10, 16,000 per month, and they need to fill in the huge pile of documents, paper-based electronic documents. They have 15, 20 minutes for a person during one session. What they can do? Nothing. They are not well motivated. And the situation is bad because these people are not well motivated. Who will work? They are volunteers, but who have verified the level of their knowledge? Who have certified them, allowing them to work with such people? I don't know. We have a great deal of programs, and again, we get together programs, but the bottleneck is the same. We don't have enough experts to work in the field. They are private doctors, but they are too cool to, and they get licensed, they earn money, but if a lot of veterans refer to them, and they need to support them free of charge because it's the case. We could expect a very quick burnt out for such experts because 95% of their customers will be veterans, and this person will not be able to earn money to cover the rent of their office. So this is a systematic problem. Who trains, how, what knowledge is provided, who works in the field, how to support and motivate those who are ready to work in the field. After some specific conference in the Ministry of Health, they bring programs to hospitals, clinics, saying that we will treat PTSD. For example, I'm a representative of such clinic. When I have some order from the central level, I can say, okay, yes, so tell me just what you need from me. But then I see that it's time to go, and I will just leave. When a veteran with a PTSD refers to such a doctor, and the doctor says, oh, you have some sleep disorder. Here's, I can prescribe you some medicine. You can leave now. Such people in the field, they do not understand what is happening with such people. And this is a global misunderstanding. On the one hand, we are afraid of PTSD because people will kill each other after the front line. And on the other hand, there is no one that these people can refer to. How can they adjust to their life after the war? And when people see a veteran without a leg, without a hand, there is quite a strange response. We can see when this person is emotionally distanced or when the responses are not in line with our expectations. When the person is detached, we are afraid. When this person comes to a bank or a shop and sees persons well-dressed, beautiful cars, saying that normal life here, such a person thinks that this is unfair. And a person has questions what to do with this, whom to refer to. Such person can refer to Oksana, and Oksana and the center, her center are able to provide the services. So we are trying to do our best. All of us are trying to do our best, but there is no one single system. Efforts is good, but we need to have a system to achieve efficiency. Answering to your question, that we don't have enough professionals, that's it. And this is like a brief explanation. The war did not start in February 2022, but in 2014. Do you know when I saw for the first time the PTSD protocols, the treatment protocols, in 2017? So it took them 3 years to translate American protocols. But they're cool, they're great, but that's it. When they say that we need to prescribe some medicine, and we don't have such medicines because they have not been registered in our country, but there are some other medicines that could be bought in our drugstores, and people decide to use them, and they don't care that there is no evidence-based approach because they are like pharmacy business, pharma companies. I can just agree with Oleksiy. There is a huge problem with the psychologists in the armed forces of Ukraine. There is a lack of such experts, and to become an expert, you need to train a lot and long time. You need to invest a lot. And these people, they don't go to the armed forces. Why is it so? And I have the same question about mobilization, how it is organized. And for me, this is sabotage when it comes to mobilization. From who? From the recruitment centers. I don't have any explanation how a person dedicating his or her life to support to others, looking at this just to join the army. No, you should be really very enthusiastic and just to join the armed forces of Ukraine, saying, so I will join it. But how many enthusiasts are there? Not so many people. And this is a huge problem. There are no healthcare professionals, no psychologists. We don't have enough of them. This is our pain. This is our general pain. How much time does it take for proper training to become a military psychologist? A military psychologist requires a separate background. And if you're if you have joined the armed forces of Ukraine, if you become military, you need to train a lot and you need to have practice. I'm not a military psychologist, so I trained, but I'm an existential psychotherapist. I got European education to become, to have a private practice, and this is actually what I do in peaceful times. I have the state education. I have attended a lot of courses, and I also studied in Lithuania. And it took me a decade, and I have a lot of practice. And I would also like to say that not all servicemen will meet those psychologists who can understand them. And I've seen such problem. We have a father and a child to our rehabilitation center, and this person is a soldier. And it is and he says that we can't understand him because we have never been there at the front line. And I don't know how much time does such training take, because this is more about training. You need to be from the same place, from the same group. So, but you cannot support this person because you have never been to the front line yourself. I don't know how long does it take to train such people. And this is not that much about theory, but about practice. You need to spend time there. You need to understand what is going on with the person. And when you feel when you should be silent, when you should say something. And if you're dishonest just for some small percentage, it is felt. And you will never be forgiven, so to say, by the military. Just your experience and what can be done is what have been said by Olena. There are the people who are not psychologists, they are sanitary instructors, but they have some methodology that they can assess a person when it comes to providing support. This is like initial sorting to identify people that require deeper aid. And let's imagine the situation when such a person comes to a medical unit saying, you know, I have some sleep disorders, I have some flashbacks, and I don't want to talk about the war. I think I have PTSD. How do you think, what response this person could have? He will not be told to go home. He will be told to return to the front line to continue his activities. So we are going to deal with PTSD after the war. And there is a big question how we will be able to deal with this. I don't know how to answer this question. And recently I made a post on my Facebook page, and the only thing that I could think of is that we will have some private centers properly funded. if we have the state centers, then there will be some grants, and I know the destiny of these grants. When we have private centers, there is more accountability there, and then we can find people, we can train them, and try to solve the issue through this approach. When it comes to state program, even to state funding program, then we come back to bottleneck. There is a lack of professionals who are ready to work in the field. To say the truth, there are programs, and they are rather quality, of good quality sometimes, but we don't have enough such programs. Thank you. And do we have questions from the floor, from our foreign colleagues? And I have a question from Oksana. We have a lot of IDPs in Odessa and Mykolaiv and Kherson. And how can you share your contacts? We are located here in Odessa, in Mariinska too, and I will share my telephone number, 048 793 5609. Thank you very much for joining us today. This is a very important topic, and you are very right in saying, Oleksiy, that we should not only discuss it, because a lot of discussions, a lot of conferences, memorandums are signed, there are resolutions, but the problem is still there. But unfortunately, there is no solution at the highest level. And I think that Olena could confirm this, that sometimes soldiers, veterans, they're embarrassed for referring to psychologists. Yes, Oleksiy has mentioned that. Unfortunately, these mental problems are stigmatized too much in our society. And this is the question of psychoeducation. This is the question of awareness. And this is that it's not understood enough. The more people understand about themselves, the less guilt or embarrassment they feel, because they think that they are not normal. Everything that happens to us, this is normal. This is a normal response to abnormal conditions. And I'm the same. I'm the same with others. And of course, we are not robots. We cannot be ideal responding to all challenges. And sometimes we need time to recover and just to bring ourselves back together. We need to be aware of some minimum about ourselves, about how we function. Thank you very much for joining us today, and thank you very much. This is all at the moment.